Silvia. I'm truly excited to introduce a new spotlight from Not Just Cooking, an exclusive interview with Dr. Larry Bergstrom from the Mayo Clinic in Arizona. Dr. Bergstrom is an assistant professor of medicine and a board-certified internist at the Mayo Clinic. He took his residency at the Mayo Graduate School of Medicine in Rochester, Minnesota, and did a fellowship in integrative medicine at the University of Arizona. He's a brilliant physician and a wonderful human being. I'm certain you will find this interview most informative. I started by asking Dr. Bergstrom to explain his practice of internal and integrative medicine at the Mayo Clinic and his vision of how to get and stay well.
My training is in internal medicine, so my feet are firmly in the conventional medical world, but integrative medicine is what I practice here. Complementary and alternative medicine is the older term for doing things which are not part of conventional medicine. We have found that there are many people that come to the Mayo Clinic for health problems that conventional medicine doesn't work well for. They either have no abnormal tests or they have things that seem to be not fixable with conventional medicine. So my interest grew from those group of patients, is that I needed more tools to deal with them. So I received some extra training in integrative medicine, which is sort of defined as taking the best of both worlds with complementary and alternative along with conventional and putting them together to help the patient become better. What I tell patients is that everybody else is here to treat your disease. I'm really here to try and help you become healthy again, no matter what else is going on. So it's worked well for patients with cancer, patients with fatigue, or patients who want to remain well. If they just want a good prevention program, this is perfect for that, because again, the focus isn't on your disease, it's really on how do you become healthy.
So it affects in reality the physical health and the mental well-being.
It is. Everything is on the table with this. So I have several tools that I use to talk to patients with. One is a circle called Medicine Wheel of Health, and it's divided into 4 parts. And the different parts of it is physical medicine or physical health, which is conventional Western medicine, which is sort of based on measurement of some sort. So when you go to your doctor and you say you don't feel very well, we say, great, let's do a whole bunch of tests. So it's blood work, x-rays, examinations. We use those pieces of information to come up with the name of your disease, and then we treat your disease. So it's important to do that well. That's why people come to the Mayo Clinic. We do that very well. But there's much more to your health than that. The second area of health I call emotional health, but it's your sympathetic nervous system, the part of you built to do fight or flight. So when we were cavemen walking through the woods and a saber-toothed tiger jumped out at us, that's the thing that saves your life. So we respond to threat with all of our stress hormones like adrenaline and cortisone, which will raise your heart rate and your blood pressure, but they change your immune system, they change your clotting factors, they change a lot of things which are all designed to help you either sort of run away from the tiger or at least survive the attack. We don't have the tigers anymore, but we can still have a lot of stress in our lives similar to the tiger, and our body behaves the same way. So with the way to address the stress effect of health on us is through mind-body medicine. So we always talk about some sort of mind-body technique, which would be prayer, meditation, yoga, tai chi, breathing, biofeedback, that sort of thing, as a way of managing what stress is doing to our health. The next area is mental health, and that's the chemistry in your brain, and that's really what psychiatry does these days, is when you have depression, you'll have some target symptoms like sleep disturbance, appetite disturbance, poor concentration, poor energy, sex drive goes away, and oftentimes a sense of loss of hope. And if a person has all those things, that's how you define a clinical depression. So that's really a separate area and needs to be managed either with medications or addressing some of their issues that are causing anxiety. And the last area is spiritual health, and that's what gives us a sense of meaning and purpose. And when a person is well, you'll develop things that define you as a person. It's your faith, it's your work, it's your family, hobbies. Some people it's their pets and things like that. But when you become ill, or there's a huge life change, many of those things may go away, which is hard on you because those are the things that give you energy. So it's important to always have something, I just say it's a robust sense of meaning to one's life. And when people become ill, that list changes. And in order to become well again, you need to find something that works for you, something that's fulfilling but within the limits of what your life and health have given you at that time.
Dr. Bergstrom's answer was very informative, and I would like to invite you to listen to it again, just to make sure you have caught all the gems he provided. To further assist you, we have prepared a graphic illustration entitled The Medicine Wheel of Health, comprising the 4 major elements: physical, emotional, mental, and spiritual health, and based on Dr. Bergstrom's comments. You'll find it under Did You Know in the introduction of this spotlight. And now let's get back to the interview with Dr. Bergstrom. We have heard so much about the French paradox and the Mediterranean diet. Could you tell us a little bit about what all the attention is about?
Yeah. The French paradox is the food we associate with people eating in France, rich, butter and cream, all the things that Julia Child had everybody eating or recommending to people. And it's good food. But it seems backwards from what we're telling Americans to eat, because we're telling people to cut back on their red meat and their dairy and because they're associated with heart disease. So the question is, how come the French can eat all this stuff that we are telling Americans is bad for them, but they live longer than we do? And they smoke, so it's a paradox. And it turns out that it's really what they're eating is helpful for them. And it has to do with kind of an anti-inflammatory diet, or what we call a Mediterranean diet, which is nuts, olives, olive oil, fruit, vegetables, fish, and things along that line. There's ingredients or components of food such as essential fatty acids. There's omega-3 fatty acid, which your body uses to make some of these anti-inflammatory compounds. Heart disease, cancer, and many other conditions have some of their origins in inflammation. So anything you can do to decrease inflammation in your body is going to be helpful for your health. So that seems to be what the French have done, is they've used foods which are anti-inflammatory, which has protected them from heart disease and cancers. Americans eat a lot of things that are pro-inflammatory, which have more predominance of omega-6 fatty acids, which is kind of what you find in red meat and dairy. So with my effort to help people be healthy again is that we work on diet, especially the Mediterranean diet or anti-inflammatory diet. And
the food pyramid, how does that fit into this?
Well, there's different kinds of food pyramids. There's the old American Dietetic Association pyramid, which is wrong. We just don't use that anymore. Mm-hmm. So I use the Mediterranean diet pyramid, which the base of it is exercise. It's 30 minutes a day. The next layer up is carbohydrates, but they should be we call low glycemic carbohydrates. Those are carbohydrates that take a while to digest. The sweet things, sweet carbs go into your bloodstream right away, and your blood sugar goes up, takes lots of insulin to push it down, and high insulin states are hard on you. So if you have carbohydrates which are slowly digested, such as oatmeal as opposed to white bread, fruit as opposed to fruit juice, those sorts of things slow down your absorption, keep your blood sugar lower. So carbs are the fuel on there. We need some of that every day. The other things in the daily part of the pyramid are fruits, beans, vegetables, olive oil, cheese, yogurt, sorts of things. And then the next layer of the pyramid is things that you would do perhaps about 3 times a week, such as fish 3 meals a week, poultry 3 meals a week, sweets 3 times a week. And then the top of the pyramid, which is red meat, which is on that diet once a month. And I define that as having come from something that had 4 legs and hooves. There are some animals that have a more favorable cholesterol profile, such as pork or bison or elk. But the omega-6 part is really what that is about, because the red meat is kind of the richest source of omega-6 for us, which is the pro-inflammatory thing. Okay. So by eating red meat less often, you get much less omega-6. And that's why Americans have such a high ratio of omega-6 to omega-3 is because we eat a lot of meat. Ideally, the ratio of omega-6 to omega-3 in your diet should be about 1 to 1, but the way most Americans eat, the ratio is about 30 to 1 of omega-6 over omega-3.
30 to 1.
Yeah, so we all have this pro-inflammatory diet because of that. So eating this way just sort of pushes you towards the omega-3 side, and it's good food. And, the French like it, so I guess hopefully it's a good sell to patients.
I was amazed to learn the enormous benefits of an anti-inflammatory diet. We all know how important it is to control our cholesterol and total lipids. But Dr. Bergstrom opened my eyes to how important a diet high in anti-inflammatory foods is to our overall health. I have included some links in the Did You Know? In the introduction of the Spotlight, where you can read more about the Mediterranean diet and some other points made by Dr. Bergstrom. But what would a Mediterranean diet be without wine? Let's find out. So now that we talked about the Mediterranean diet, and could you tell us a little bit, how about wine?
Okay, wine is a good source for something called flavonoids, and flavonoids are kind of the dark pigment in the skin of purple grapes and blueberries and blackberries. And the flavonoids are sort of the anti-aging, anti-cancer substances. So if you get some of that in every day, that's also helpful for protecting you from inflammation. So it's one of the antioxidants. If people can't eat fruit, there is a pill form of it. It's grapeseed extract, contains a lot of these flavonoids. I'd much rather have people eat food, then you don't have to worry about supplements.
And what about resveratrol?
Resveratrol is one of the flavonoids that's in red wine. So the flavonoids is a broader category. Resveratrol is kind of the most famous one.
Okay.
But you can take that as a pill form as well, but again, if you eat food, then you don't need pills.
So if somebody really would like to start the Mediterranean diet, follow the food pyramid, what would be a good advice how to start it?
There are several books out there about the Mediterranean diet. I think the Mayo Clinic is publishing a Mediterranean diet as well. I don't know that that's available yet. But there's a lot of information out there about it. There's many websites that talk about foods, but the basic elements of that diet are things I mentioned earlier. It's sort of staying away from dairy, beef, red meat, and going more towards vegetables and fruit and olives and that sort of thing.
And we all would benefit of it.
Yeah, it's to help people live longer.
Okay.
And to be healthy. So if a patient comes to me and says, I want to live a long time, it's exercise, nutrition, and stress reduction. If you have cancer and you want to know how to help yourself get better, it's exercise, nutrition, and stress reduction. It's the same thing because it's really directed at how to make your body healthier.
We are all aware of the importance of nutrition and exercise, but Dr. Bergstrom added stress reduction, and I realized how extremely important this was, especially taking in context with his previous comments. that our health does not only include our physical health, but also our spiritual, emotional, and mental well-being. So stress reduction was the basis of my next question to him. Dr. Bergstrom, could you talk a little bit about stress reduction? You mentioned it a few times.
Yeah, it's one of the three basic elements of health, which are exercise, nutrition, and stress reduction. The circle that I mentioned earlier, the emotional health part, which is your sympathetic nervous system response to stress, is really where stress reduction works. And mind-body therapies are kind of the best way of doing that, and those are simple things like meditation, prayer meditation, yoga, tai chi, breathing, biofeedback are all sort of directed at decreasing your sympathetic nervous system activity, which is really the stress reduction. It would be nice if we could tell everybody to get rid of their stress, but this is just what we get from living. It's not just your health issues, it's your finances, and it's the family, and it's your neighbors, and global warming, and politics, and all of these things that we just live with. When you're coping well, you don't really realize what the stress is doing to you, but it does have an effect on your health, which you can prevent or at least block or blunt by doing some of these mind-body therapies.
Before continuing the interview, I would feel remiss if I wouldn't show a little of the Mayo Clinic's beautiful state-of-the-art facility in Scottsdale, Arizona. The clinic is surrounded by desert. The architecture is stunning and very modern, complemented by a beautiful landscaping design in complete balance with the structure. Everything is geared to invite the patient in and to provide a feeling of comfort and peace. The focal point in the vast lobby is a unique sculpture water feature under a glass dome, a piano which is regularly played by volunteers or patients, brings soft music to the patient's ears, and beautiful art pieces invite contemplation. At my last visit, I admired this painting by Ed Mell. The history of the Mayo Clinic is rich, and displays, such as this one, give insight and understanding why the Mayo Clinic brings so much hope to so many. In the spirit of the Mayo Clinic's mission statement and vision, you also can find relaxation and peace on the nature trail next to the clinic. I walk it often, and the petrified wood always touches me deeply. Hope? Yes. Look at the little plant growing out of the rock, which says it all. Let's listen to Dr. Bergstrom giving a brief summary of how to incorporate all this in our daily routine. And although I thank Dr. Bergstrom at the end of this video clip, keep on watching, we have a bonus for you.
An important aspect of being healthy is we have many things that are competing for our time. Everybody has their little schedule that they lay out every day and they follow through it. You need to have a slot on that schedule. You need to be able to set aside some time to take care of yourself, and that's where all of these things come from. For example, exercise. The best way of exercising is to decide when you're going to bed the night before, when you're going to exercise the next day, so when you wake up, it's on your schedule. Because if you wake up in the morning and say, sometime today I'm going to exercise, you aren't going to do it, because the whole day is going to go by. So it's committing to that. And the Mediterranean diet, you have to shop with the intent that that's what you're going to eat. It's always helpful if you're going to cook for yourself as well. The stress reduction, again, is finding one of those mind-body things that you can do on a daily basis. There are some things you can do when you're stressed at that moment, such as the breathing exercises, but to really get the benefit of the mind-body therapies is you need to set aside some time every day to meditate or to do yoga or to do tai chi or whatever it is that you find to be suitable for you. But it has to become a priority for you to become healthy. I tell patients I don't have a pill that will exercise for them. So it's really you taking care of yourself. And I think integrated medicine is just giving patients a lot of tools to use for themselves to make themselves healthier.
Well, it has made a difference for me, and I appreciate all the input, and you have helped me along over time. And Dr. Bergstrom, I really want to thank you for the time you have given to me and for all the vast knowledge you have shared, which we all can benefit from. And like always, the Mayo is leading the way.
Thank you.
And now to the bonus. After the interview was completed, Dr. Bergstrom and I were chatting, thinking the cameras were off. But there was still one camera running, and we caught this beautiful moment with Dr. Bergstrom.
So the spices, the colorful things that we put in our cooking is where all the anti-cancer stuff is. So the more spices and flavorings that you use makes the food taste better, but that's actually where the healthy stuff is. I grew up in a Scandinavian home where all food was sort of a shade of tan. And the world is much more interesting than that, but that's actually a healthier way of eating, is to put all that color in there.
It's interesting to know, because naturally that's where I kind of tend to be. I like herbs, I like spices, I like color.
Yeah. There's a book by a guy named Dr. Agarwal. It's called Healing Spices, but he goes through 50 spices and gives a little monograph about each one and how to cook with them and what they do for you. Turmeric's wonderful stuff. It's kind of anti-inflammatory, anti-cancer, anti-aging, antioxidant. It's all of the things that you want. So
I have to get that book.
doing some of those things on a daily basis is helpful.
I hope you have found this interview interesting and informative. It reflects so much what we want to portray in Not Just Cooking. We have to take care of our physical body, but cannot forget the other three parts: spiritual, mental, and emotional. Only a balance between the four will give us great well-being and a happy life. Let's start today. There is never a better moment than the now. Why wait? Let's nurture ourselves and enjoy life to the fullest. I wish you great well-being.